Welcome to Back Talk, the premier podcast from Successful Black Parenting Magazine, featuring in-depth conversations and expert insights on crucial topics for Black families. We are ranked one of the top 4 Black family podcasts on FeedSpot. Now, I'm your host, Janice Robinson Celeste. Now, what if by simply saying yes to one quick blood test, you could uncover the one piece of information that changes everything about your baby's future? And yet, most women never even heard about it. Well, stay tuned and join in on the conversation. I'll be right back.
This is Back Talk by Successful Black Parenting Magazine, the most listened to podcast for parents by parents.
Hello, everyone. Thanks for tuning into Back Talk by Successful Black Parenting Magazine, your go-to podcast talk show for parents. We are live. You can ask questions by posting in the comment section on our Facebook and YouTube, but do it early because we want to make sure we include you. Share our podcast with your friends right now. Shout it out to your followers because sharing is truly caring. And don't forget to use hashtag BackTalk when you post. I have Dr. Dallas Reed, who is joining us here today on Back Talk, and she is here to demystify prenatal genetic testing for expectant parents. Welcome to the show, Dr. Reed.
Thank you. Thank you so much for having me.
Let's start by introducing yourself to our audience. Tell them who you are and what you do.
Sure. Where to begin? So I'm a physician. I am a double board certified OBGYN and medical geneticist. I work at Tufts Medical Center in Boston, and I'm the division chief of genetics there. I also am the director of perinatal genetics, and I have 2 clinical practices, one that's average risk obstetrics patients, and then my medical genetics practice as well. And then I also do a lot of consulting for genetic testing companies such as Myriad Genetics, and some other things on the side as well, using my expertise to educate couples and families that are growing about genetics and why it's important to them.
That's fantastic. Before we get into this, though, we always start by just doing an icebreaker so people get to know the other side of you a little bit. So
Sure.
our icebreaker is, what's one thing about you that most people don't know that you would like to share?
Hmm. I would say one thing about me is, and I do a lot of mentoring for medical students and residents, for example. So at my institution, I'm one of the few Black physicians, one of the only Black physicians in our department of OBGYN. And so a lot of people come your way. And I think once you get to a certain point in your medical career and the leadership roles that you have, people think that it was a very straight line from the dream that you had to where you are now. And I think that, all of us in this field of medicine and in life, really, it's not a straight line. It's a very windy road to get to where you are and to get to the success that you are and that you have. And all of that is really important in growing your maturity and your resilience and your ability to sort of overcome challenges. And so, I've had challenges in my road to where I am now, that I share with especially students that are also going through challenges. And so I think that like when you look at somebody, they might look like they have it all together and that it was an easy road for them, but you should know that it's not a straight line. It's a windy road, and maybe ask them about that one day.
That's a great answer, and that's absolutely true in life. So thank you for that. Let's talk about the genetic testing. What kind of conditions are you looking for, especially for in Black moms who are pregnant?
Yeah, I love to bring this topic up to diverse audiences. And we definitely know when it comes to genetic testing that Black pregnant people and Black families are being talked to about genetic testing less, they're utilizing it less. And
Mm-hmm.
there's a lot of fear, I think, that comes with it. And so I mentioned Myriad Genetics, which is a genetic testing company that I consult for. They do genetic testing for prenatal genetic testing, which includes testing for Down syndrome screening and other genetic conditions that could present in fetuses. They also do something called carrier screening through a test called Foresight, which is looking at genetic conditions that may run in a family, even though no one in the family has ever had that condition. And so those are the two that are relevant to the prenatal setting, but they also do testing for cancer genetics. So people who have cancer in their family. And one of the things that I really, like about Myriad is that they said, let's figure out why people aren't utilizing this test, not just from their company, but just across the board, like why it's not being utilized as much as it should be, knowing what the benefits are of it. And they did a survey actually to ask expectant parents or people that were already parents, why, what do you know about genetic testing? Is it something that you were offered? And what they know is that the majority of people that were asked want prenatal genetic screening once they know what it is and how it works and how it can help them with all of making decisions about all of their options as they go along with their pregnancy. And 4 in 10 didn't even remember having a conversation about it. So was it talked about and they don't remember, or was it not talked about at all? I think that's hard to say, but a large number of people don't even know about this. And so I'm very happy to have platforms like this to talk about it so people can learn more about it.
So I don't remember any of this, but I was pregnant a long, long, long time ago. So
Yeah.
how new is this to the world, like genetic testing for pregnant women?
Yeah, so genetic screening for genetic conditions like Down syndrome has been happening for decades. It wasn't with the way that we're doing it now, and it actually wasn't with DNA testing previously. But I would say 2011 is when this technology went sort of mainstream and became commercially available. The technology is called non-invasive prenatal testing, or NIPT is sometimes what it's called. It has some other names as well. Cell-free DNA is another name for it. And essentially what it is it's a test, a blood test from the pregnant person. And in that blood are little fragments of DNA from the pregnant person and little fragments of DNA from the placenta. And what the technology does is it looks to see, is there extra DNA where there shouldn't be? Is there not enough DNA where there should be more? And depending on what type of test a provider or physician orders, it can let us know if there's a chance that the fetus could have conditions like Down syndrome or trisomy 13 or trisomy 18, which are two other genetic conditions. We also can look at what's called the sex chromosome. So that can tell us the sex of a fetus, the genetic sex of a fetus. It also can tell us if there's more or less of that DNA than there typically is, which can be a host of other genetic conditions. And so it is, 2011, I would say, is when that started to become more mainstream. And then over the years, recommendations have come out that said, this really should be offered to every pregnant person. Earlier, it was typically offered to people that were high risk, so
Mhm.
older than 35 at delivery, or had a previous child with one of these conditions, or had ultrasound findings that were, abnormal. But nowadays, it should be offered to every pregnant person.
That's great. Can it detect certain diseases as well, like sickle cell anemia that are pretty present in the Black community, or is that something else that you would need to do to find out if you were susceptible to that? Or
So that's a very interesting question because we're in such an interesting time with this technology. So,
Mhm,
um, traditionally, the non-invasive prenatal testing just looked at the group of conditions I just mentioned, things
mhm,
called trisomies like Down syndrome and sex chromosomes. A different test that I mentioned earlier called carrier screening is a test that looks at a set of what we call recessive conditions. So
mhm.
recessive conditions are one that a parent could be a carrier for but not have any features of the condition, not have any problems from being a carrier. But if they have a child with a person who's also a carrier, this is where sickle cell is a good example. If a mother and a father are both carriers for sickle cell, then they have a 25% chance of having a child with sickle cell anemia. So that kind of testing is called carrier screening, and that has also expanded over the years, where we used to just do screening based on somebody's ethnic background or what they thought their ethnic background was, but we've sort of evolved as well. Genetic testing has become more affordable. And we recognize that that's really not the most equitable approach. And so now many societies, like the American College of Medical Genetics, recommend doing carrier screening that's pretty broad, like 100 or so conditions, offer it to everybody that is pregnant or wants to become pregnant, male and female, to see if they're carriers for any of these conditions, because they wouldn't know otherwise unless uh, they or their parents are both carriers and they had a sibling with the condition, there's no other way that they would know that. So many people don't have family members with these recessive conditions, even though they're carriers for them. But the
Right.
reason I say it's an interesting time is because now the technology has evolved in such a way that we are now able, for some laboratories, able to do some of those recessive conditions at the same time with the same blood draw as the Down syndrome screening. So that is really exciting. Like the possibilities are really endless with what we can do and how helpful that can be to minimize the number of different blood draws that have to be done and really just standardize things across the board for our patients.
Okay. So let me ask you, how does it help to know early what's going on with your baby? I mean, it's a simple question, but what is it going to do for the family? Like, what do they? I mean, I imagine sometimes they have to make hard decisions.
Yeah, you're right. So one of the things, with Myriad, when they did that survey that I mentioned, they used the information from that survey to create this website called Know More Sooner at
Mhm.
KNOW More Sooner. .com, and it is meant to sort of dispel some of these myths and talk about what are some of the things you can do with this information. So when you think about carrier screening, ideally we want people to do carrier screening before they get pregnant. And the reason for that is that gives you the most options out there. So if we know that one partner is a carrier for a genetic condition, let's say sickle cell anemia, we want to test their partner to see if their partner is also a carrier. If they're both partners, like I mentioned before, there's a 25% chance that they could have a child with that condition. So now they know that information. What can we do with that? They could say, that's good to know. I'm going to continue on and get pregnant spontaneously. I will potentially do a test during the pregnancy to test to see if my fetus has this condition. Or maybe I won't do that, but know that I'll need to do that test right away when the baby's born, or have them deliver at a hospital where they'll have the right types of specialists available in case there's any complications due to that possible diagnosis for the fetus. They could say, actually, I have people in my family that have this condition, and it was really challenging for my family members. And so, if I could, I'd like to not have a child with this condition. So, I'm going to do in vitro fertilization, for example, put the sperm and the egg together in the lab, and then you could do actual genetic testing on the embryo to figure out which embryos have sickle cell anemia, which ones are just carriers, and which ones don't have any genetics mutations, and then use those embryos to create pregnancies. And so, having information from carrier screening allows you to decide if you have it before you are pregnant, the most options available to you. But even if it's done early in pregnancy, it may mean that you want to deliver at a certain hospital or want to talk to certain specialists before the baby's born. Or make any number of choices that are right for your family. So it allows you to do that kind of planning. And similarly for the NIPT, the non-invasive prenatal testing, where we are looking at Down syndrome and other genetic conditions, that you can't do before pregnancy because you need the placental DNA during the pregnancy, as that's part of the test. But similarly, that test is done very early in pregnancy. Myriad's test is done as early as 8 weeks of pregnancy. And so you have that information. It's important to know that that information from the NIPT test is what we call a screening test, meaning it's not saying yes or no. It's saying there's a high risk or a low risk that the fetus could have one of these conditions, and other tests need to be done. But it's done early enough that you can get those other tests done and then make, the decisions that you need to make about proceeding with the pregnancy, not proceeding with the pregnancy, or getting specialized care and delivering at a specialized center if that's what's necessary.
Okay. When these results come back negative, what does that really mean for the baby's health? And should parents interpret that as a peace of mind?
Yeah, that is a great question. So, the NIPT test, like I mentioned, is a screening test. So it says high risk, low risk, and it is very, very good. The NIPT is, if it says that it's a negative or low risk, that's like a 1 in 10,000 chance that the fetus could have Down syndrome or some of the other genetic conditions. Um, Typically, we don't just take that piece of information into account when we're taking care of a patient who's pregnant. So that's one piece of information. But if you had an ultrasound that showed, differences of the fetal development, a heart issue or the size issue or the brain differences, then that may require other tests to figure out what's going on. So screening tests means high risk, low risk, not yes or no. So you should be reassured, but if there's other things that pop up, then there are other things available to help us know yes or no answers. As
Okay.
far as the carrier screening goes, if somebody is not a carrier for a condition, then we know there's a very, very low chance that their child could develop that condition. It's not zero, because spontaneous genetic changes can happen in fetuses that are not inherited, but the chances are very, very low, and it should also be reassuring.
Okay. Do you even need the family's medical history, like from their fathers and everyone else in their lineage, or can you just tailor your genetic testing based on what they know, at face value?
Yeah, another great question. So, as part of being a geneticist, what we do when we take care of patients under the genetic setting is we do family history. So, we actually
Mhm.
draw out family trees. It's called a pedigree when we're doing those types of appointments. And I will say the more information you know, the better. But I also understand families are complicated. People don't talk to each other, people don't tell the truth, people don't know their history. And so, when it comes to carrier screening, and just pregnancy in general, ideally, it is good to know as much as you can because the carrier screening test looks at, 100 or so conditions. The biggest ones out there on the market cover maybe 700 conditions, but that's not every condition known to man. And not every condition is this type in which both parents are carriers. Sometimes there are conditions in which only one parent has to have the genetic mutation in order to pass it on to their child. And so, I still think it's good to know your family history. But if you don't know it, it doesn't mean you can't have the test. And that is part of the reason why the test is, I think, really beneficial to people because one, they may not know their history, but two, these recessive conditions, like I mentioned before, may not be exhibited in the family because nobody else has had a child with another carrier. So it's kind of hidden in the family, and you really wouldn't know it until two carriers come together to have children. So the more you know, the better, but it's not a deal breaker. It doesn't mean we can't do it, and it's still beneficial, even if you don't have all of the details of your family history.
Right. And one of the reasons we're doing this interview today is because most women, pregnant or not, they don't know this is even available to them. They have no
Right.
idea. So, what steps should providers take to present non invasive prenatal screening options in a way that feels clear and respectful to women or to, I should say, a pregnant person because, I just want to be right with that.
Yeah, yeah, yes, yeah, yeah. So I would say, that it's the age of social media where people are going lots of places to get information. I think there's pros and cons to that as being a doctor who sometimes have patients come in and ask me a question and then I answer their question and they say, "Oh yeah, that's what TikTok said." And I'm like, "Okay." I'm glad me and TikTok are on the same page with our medical training. But I say that jokingly. I mean, I certainly think it's hard for patients to get all the information from one source. And I think there are good informational things out there on social media, but things like this, where you can bring things to your doctor and say, "Hey, I heard about this on a podcast. I don't think we've ever talked about it. Is this something that you offer in your office?" I think also the website I talked about before, knowmoresooner.com, is a great place for information. It also has, it's dispelling myths and giving information. It also has links to the tests that Myriad have in particular.
Mhm.
So patients can learn more and people can learn more about the testing there. But really, every doctor's office should be offering something in the way of screening for genetic conditions in pregnancy. And so it may not be this, even though we know the guidelines say that this is something that should be offered to everybody. And so, I think the patients can bring something to the table in regards to this. And then, we, I think as a professional society, need to do a better job of educating our colleagues. And that's one of the things I really like about the work that I do is that it's not very common. I mean, I probably should have said this at the beginning, to have an OB/GYN and a medical geneticist in one person is pretty uncommon. There's probably about 40 of us in the country, and a handful that are Black, I would say. And so it's really, really not a common combination. And so most of the OBGYNs you're going to go to do not have like extra training in genetics, but they should know about this testing, or they should have colleagues, prenatal genetic counselors, or people that are master's trained and specialize in talking about genetics with patients and physicians, to be quite honest with you. They should have those colleagues available to them if they're not sure what this is. And so a patient could always have a consultation with a prenatal genetic counselor if their doctor or midwife isn't familiar.
Okay. Cost, because genetic tests, they can carry out of pocket costs for
Yeah.
families. So I mean, what strategies do you suggest for navigating insurance benefits? Do they even pay for this?
Yeah, that's also a great, you have all the great questions. And this is a very common part of the discussion when patients come to my office. It's obviously going to be like state and insurance dependent, but genetic testing companies like Myriad Genetics usually have a pretty favorable approach to cost, where they typically do what's called a benefits investigation with the patient's insurance. Once the sample is received by the laboratory, they then talk to the insurance about the cost of the testing, and then reach out to the patient if there's going to be an out-of-pocket cost. For Myriad, if it's going to be more than a $100 out of pocket, they'll let the patient know before they finish running the test and talk to them about their payment options. There's usually an option for an out-of-pocket cost of $250 or $249 if it's going to be a very high cost, if like a patient has a high deductible, for example. Some types of insurances, like Medicaid insurances, the person probably will not have an out-of-pocket cost. But that is a great question. You know, it's individual. You're going to have to. I can tell you what it's like in Massachusetts, in my state, and the payers that I deal with. But you know, there's also information about costs on the website for Myriad Genetics and sort of how they deal with that. But I think that's another reason I have enjoyed partnering with them, is because they are trying to make this accessible to patients, and make cost not a prohibitive factor like in the decision making, because these are such important pieces of information for people to know like how to proceed with building their family.
Right. Now, without insurance, what would the average cost be if you had to take a guess?
Yeah, like I don't know the answer to that,
Okay.
because I'm in
Mhm.
Massachusetts, where it's a mandated insurance state, so everybody
Okay.
has insurance. But I do know that Myriad will, there are cash pay options that are like in that $250 range. So that's what we've been told, that that's the max out of pocket someone would have to pay, if they don't have insurance, don't want to use their insurance, or their insurance is going to be much higher, and so they don't want to apply their insurance towards the testing.
Okay. You talked about nomoresooner.com, which I put at the bottom of the screen. What other resources are there any cultural resources? Like we know we have some birthing centers that cater to Black moms because of the maternal, mortality rate. What other resources are out there?
Yeah, so as far as cultural resources, I don't have anything offhand related to that. The societies that we subscribe to, or that help us make our guidelines and the things that we follow, are for genetics. It's called the American College of Medical Genetics, or ACMG. They often have some patient-facing materials. The American College of OBGYN, or ACOG, also has some patient-facing materials. Um, and those are the two that come to mind. Often I have like pamphlets and things available from the genetic testing company in my office that give patients information. And I'm happy to send you some things afterwards, that you can maybe share with the listeners, that they could go to learn more information about these tests.
No, that's fantastic. I would love to get that, and then we can also roll that into maybe an article for our publication with this accompanying video. So I think that would help moms make some
Yeah.
decisions. So let's talk about the sneak peek promise a little
Yeah.
bit. Tell people what that's about.
So SneakPeek is another test by Myriad Genetics. I think they're the only ones that have this test available. It's available in stores, so it's not a test like The carrier screening the Foresight carrier screening is the name of the one from Myriad, or Prequel prenatal screen is the one for non-invasive prenatal testing from Myriad. Those have to be through your doctor. So you can get information and bring it to your doctor if they haven't talked to you about it yet, or your doctor, can order it directly. But SneakPeek is one that you can get at the store, like at Walgreens, for example, Amazon. It's like it doesn't involve the physician. And SneakPeek is giving you a sneak peek into the sex of the fetus. And so I have to say, as an OBGYN, seeing pregnant patients, it's like literally the first thing they want to know after, like, is my baby okay? Is there a heartbeat? As early as possible, they want to know the sex of the baby. And so Sneak Peek allows you to know that information as early as 6 weeks. And it just tells you that it's predicted to be male, predicted to be female, lets people start to bond with their baby as early as 6 weeks, which I think is really helpful for patients. Pregnancy is hard, and people have so much anxiety and so much to think about, and so much that they're wondering about as pregnancies go on. So if we can kind of check one thing off the list early on, I think that they really appreciate that, and I do think it helps them to bond with their babies.
We're going to come back to the bonding part, but are these
Yeah.
tests reliable? Are they really reliable? And
Yeah,
what?
it
Go
is
ahead.
reliable. Yeah, it is reliable. There are pretty clear instructions on how to collect the sample. So it's an at-home, it's still a blood test that's collected at home. And so there are some pretty specific directions on how to do that. So as long as those directions are followed and they have good quality data when they get the DNA, then the testing is very reliable. If it's unclear or the data isn't clear, then they won't just issue a result that says, male or female. They will say, like, this, we weren't able to complete this testing. And same is true for the Foresight carrier screening and the prenatal screen, that there can be things that make it so that a result isn't attainable. But if they are able to get a result, then it is pretty reliable, keeping in mind that the prenatal screen is a screen, not a yes no test. It's a high risk, low risk test. So if it says low risk, it's not saying there's no chance that the fetus could have one of those conditions.
Got it. Okay. So let's go back to the sneak peek promise, because I just think that's fascinating that we can go to Walgreens and find out the sex of our baby and it's accurate. Like, is it a test that you send out, or is it a test, like, it's not a test like you like a pee stick, they say, right? It's not
No, yeah. No,
not
it's
that.
not like a urine pregnancy test. No,
Right.
it is a blood sample that is collected.
Okay.
And I will say, typically what I tell my patients in the office is that the blood test, so either Sneak Peek or the Prequel prenatal screen, they both will look at fetal sex. They are as accurate as ultrasound.
Wow.
So it's not 100%. Nothing in genetics is 100%, so we'll never say that. But it's 99% accurate that if they are seeing the male sex chromosomes, which, taking you back to high school biology, are X and Y chromosomes, then they're going to tell you that it's expected to be male. If they see no Y chromosome, then they're going to tell you they expect it to be female. So that they can say with 99% certainty. Now, there
Wow.
can be, to get into deep genetics, there can be genetic conditions that cause the sex chromosomes to be XY, which we typically associate with male sex, and then the genitalia don't appear male. That's a whole different thing. That's a whole genetic condition. And that doesn't mean the test was wrong. The test saw XY. There is XY, but there's other sort of biological and genetic reasons that the genitalia don't appear male. So that's getting deep into the weeds of my
Mhm.
work, but I wouldn't count that as being, like, unreliable. I would count that as that it was correct. It saw what it saw, but there's other reasons why that might not be the case on what you see when the baby's born.
Wow, all of this is so interesting. It really is. So let's get back to bonding. Like, how can knowing the gender sooner support parent baby bonding?
Well, I think it's something very important. Now, I wouldn't say to all couples, but to some couples, it is a very important thing for them to start the process of thinking of names and thinking about what the nursery will look like and starting to share that information. We know that gender reveals are very popular these days. Just like to build a community that they have around that pregnancy and that baby. We know that. Community is really important in pregnancy and the postpartum period and building that support. And so I think that it is something that just brings people together and helps them to sort of focus a lot of their nervous energy around something positive, and they can start really, a lot of people feel like they really can start planning once they know if they're having a boy or girl.
Yeah, I love that idea. That way you can decorate and do whatever you want.
Yeah.
We're not sticking to traditional colors like blue and pink anymore, but still, you still might want to know just so that way you can tell, if you want to tell everyone so that they can get you appropriate gifts. That's
Yeah, I
fantastic.
mean, there's a reason gender reveals are so big, right? That
Yeah.
people are really into them. And so people really want to know as soon as possible, even if it's just going to be in an envelope somewhere for someone else to open and put the cake together and all of that. They just really, really want to know as soon as they can.
I like that.
And it's also, sorry to interrupt, but it's
No.
also like the first question somebody asks you, like, oh my God, I'm pregnant. They're like, is it a boy or a girl? Right? That's the first question you get. So everybody's fascinated with knowing if it's a boy or a girl. So sneak peek
Yeah.
6 weeks, you can know.
So now you
And
guys know.
I should say in the doctor's office, you usually can't know until, Prequel, you can do as early as 8 weeks. Some of the other competitors, not until 10 weeks. And then the ultrasound doesn't really show you until like 18 to 20 weeks when you have that big anatomy ultrasound. So 20 weeks, 6 weeks, that's a big difference if you're going through a pregnancy.
Wait, how soon with Sneak Peek?
6 weeks.
6 weeks. Oh, they should be
Like
advertising on our website,
Like
really.
you literally just found out you were pregnant 5 seconds ago and do the test and
Wow.
you can find out. I should also say the nice thing about Sneak Peek is you can get the results same day or next day that the blood is received by the laboratory. So it's also like not only is it early, you also get results back really, really quick.
Okay, so you guys heard it here. If you don't know about it, and you're pregnant, or you just found out you're pregnant, you can even find out what sex your baby is pretty much as soon as you found out. That's
Right,
fantastic.
exactly.
Wow. Okay.
Yeah.
Now you talked about patients coming to you from TikTok with their
Yeah.
theories and things. What are the most common myths that you hear about prenatal genetic testing, and how do you guide moms to distinguish from facts and fiction? Like, what do you say?
Yeah, I mean, we're in such a time of like distrust of the medical field, and I think
Yeah.
in pregnancy care, to be honest, it's for good reason in some ways. So, I really try to figure out what my patients are feeling, if they have distrust, where that's coming from, and all of that. I think one of the things that I hear a lot about carrier screening in particular is I don't really need to do that test because nobody in my family has any of those conditions. And as we talked about already a couple times, that is pretty common. Like I'm somebody who sees children with rare genetic conditions who have recessive conditions because their parents were both carriers and had nobody in the family with those conditions. Like that's how these conditions happen. And that's the pattern that we typically see in a family history. And so the reason that we're offering that test is if we could just rely on everybody having had a family member with it and coming to us and telling us that, then we would easily know who's at risk and who's not at risk. But you don't know that with these recessive conditions. And so that's why carrier screening can be beneficial. So, that's one myth, is that nobody in my family had this, so I don't need to do it. I think the second myth is what people think you can do with the information. So, it's a really interesting time in our country right now. And I'm in Massachusetts, where there's a lot of protections for reproductive health and reproductive decision making. And obviously, there's places where there's more restrictions than there are in my state. But I think a lot of people think either carrier screening or NIPT is just like for people to decide if they want to have an abortion or not. And that's actually not
Mhm.
true. There's a lot more information that you can gather. And I would say many times, even in my state where we have pretty generous laws around abortion. If we find that a fetus has Down syndrome, because we do the NIPT screening test, that comes back high risk, and we follow that up with a confirmatory test, which is what we suggest you do if the screening test is abnormal, and we show that the fetus has Down syndrome. I have lots of patients that are continuing their pregnancies, but they want to continue at a place where let me talk to Dr. Reed, the geneticist, so that I can talk to her about what it would be like to have a child with Down syndrome and what kind of care my child would need. Are there other specialists that my child would need? We know Down syndrome is associated with cardiac defects, for example. Let me meet with the pediatric cardiologist before my baby's born to figure out what is happening with the heart. Let me make sure I'm delivering at the right hospital where I have those specialists available to me right away, and they don't have to whisk my baby off to another hospital, and I'm here over here recovering for 2 or 3 days before I can go see my baby, right? Like, there's a lot of planning that you can do if you know things in advance, and that planning doesn't necessarily mean continuing or not continuing a pregnancy. It means, how is my family going to welcome this baby? Can I educate myself about this condition? Can I prepare my children that I already have to have a brother or sister that has, special needs? Like, what can we all do to help this child thrive? And so that is a big myth that I want people to know, is that that's not why we're asking you about these tests, because we want you to make a decision about continuing or not continuing. It's about, like, giving you the most information and helping you be as prepared as possible.
Okay. And how do you guide moms to distinguish fact from fiction when they come to you with these myths?
Yeah, I mean, it's not like a quick conversation, as you can imagine, because I'm not on TikTok all the time, and so some of these things that people bring to me, I've never even heard of before. I think I have a pretty good relationship with my patients, and so one way is just to be open and non-judgmental and saying, okay, well, tell me more about that. Like, how did you find that information, or why was that interesting to you, or what about that was intriguing to you? And then I'm not really here to kind of like tell them you're wrong or that's not true, but I just tell them, like, from my experience in the medical perspective, like, here's what we offer and this is why we offer it. This comes up a lot when patients want to do a birth plan. So that's usually the first question is, do I need a birth plan? And my answer is, you don't need a birth plan. It's not a requirement. We have pretty structured ways and protocols and things like that about how to take care of pregnant patients and deliver babies and how to react to certain situations. But if a patient has certain preferences that they want to make sure are very clear to us, I do think it's helpful to write them down. And I like to go through every single line of the birth plan with my patients and say, okay, you said you didn't want Pitocin. Let's talk about that. Why don't you want Pitocin? Let's talk about what it's used for and what scenarios we use it and why we use it. And what I find is, like, once we actually sit down and talk about it, we're on the same page at the end of the day. Like, they understand in what situations we would offer it, and they can decide if they want to use it or not use it. But most of the time after that conversation, patients are like, okay, yeah, that makes sense. Another thing I tell patients is just to, you you obviously, it's a very scary time to have a baby. I have 2 kids myself. Even knowing all of this that I know about pregnancy and postpartum care, it's still a scary time to go through a pregnancy and deliver. You don't know what's going to happen. But I want to make sure that they feel empowered, or their support person feels empowered to um, you know, know the pros and cons of everything that's being offered to them. Like, what are the risks of doing it? What are the benefits of doing it? What happens if I do nothing? Right? Make sure you understand the answers to all those questions, and then you're going to make the best decision for you and your baby. But if you're not being told those things, you need to escalate, to somebody higher than the person you're talking to if you're not getting those answers to those questions.
That's a good point. And you use non-judgmental. And I think that's so important for practitioners today, because a lot of women will just stop asking questions. And the fact that you gave them just a point to go over their head, which a lot of people will never do. I just know that they don't even know to do that. I think those are great points for parents or parents to be to that you just brought up. I would have never thought even myself necessarily, depending on, I guess, what happened, to go over the doctor's head. You kind of look at
Yeah.
that person as the end all.
Yeah, I mean, but we're not there alone, right? Like
Right.
if a patient wants a second opinion, essentially, they can have that. Usually, there is another physician that's on backup or available, to have a consultation with. And but I really think if people just um understand like the pros and cons of things. I mean, maybe I'm naive, but I think that social media will tell people don't do this. You shouldn't do this because da 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 da. And all of the context in that scenario is not explained, and that context may not apply to the context of the person that's sitting in front of me. And so the person that's sitting in front of me, if we are deciding you're you're in labor, but the labor's not progressing, I'm going to suggest we start Pitocin. And if you're like, I don't want to do Pitocin, TikTok told me not to do Pitocin. I think that's when we say, okay, well, here's why we would suggest it, and here are the pros, here are the risks, and this is what happens if we don't do it. You decide what is the best decision for you, because at the end of the day, like there's only so many ways this is going to go, right? There's only so many ways to have a baby. And so people, I think, if they just really understand like where we're coming from, then they get to make the choice. I'm not here to make the choice.
Right. Right. Now we're at the almost the end of our time. What's one thing that you haven't said that you would want to say to women, especially our audience, which are Black women, that you have not said so far?
We've talked a lot about the prenatal genetic testing, the carrier screening. Foresight carrier screening is the Myriad product, and then the Prequel prenatal screen is the NIPT test. So I want you to make sure you talk to your doctors about that. I want to make sure that you are offered a what we call expanded carrier screen, which is like not just focusing on sickle cell and a couple other conditions, but looking at that broad set of conditions that you may be a carrier for, and that's the more equitable approach. But I also want to make a plug in for the other part of genetic testing that often should be talked about in the OBGYN setting, which is hereditary cancer testing.
Hmm.
So Myriad Genetics has a product that's called MyRisk. They have this nice other part of it called a risk score. But what this is a genetic test to look to see if an individual has any genetic mutations that put them at higher risk of developing cancer. So you may have heard of BRCA1 or 2 or the BRCA genes. Those are two genes that increase the risk for breast and ovarian cancer the
Mhm.
most. Um, for breast cancer, if you think of like the general population, has about 12% chance of developing breast cancer. If a BRCA1 or mutation, if somebody has that, then they have up to a 90%, almost 90% chance of developing breast cancer in their lifetime. So this is where talking to your family about cancer history is super important, because if you tell your doctor, oh, there's breast and ovarian and pancreatic cancers in my family, if they're a good doctor, they're going to suggest that you talk to somebody about that history and consider genetic testing. Um, so I want you to also know that this is available and that it can be life saving
Mhm.
to know about that history, talk to a professional about the genetic testing, pros and cons again, about the genetic testing for you. And if you do that testing and find you have a mutation, there are things we can do to do extra screening, to find earlier cancers that are curable, prevent cancers altogether, depending on the type of cancer. And if we know that information for yourself, we can know that your family members are at a 50% chance of having it as well, so it can affect your brothers and sisters and parents and children. And so it can be like life changing for a family. And Black people definitely are not being talked to, even Black women with breast cancer who have clear high risk factors for a genetic cause of their breast cancer are not having these conversations with their doctors. And
Mhm.
part of it's on the doctor's side, right?
Mhm.
Like not bringing it up because patients just aren't supposed to know about this just because they walked in the door with cancer. But it's something that you should know about. And it's important even in the reproductive age. This is not just something we're thinking about for postmenopausal. People are getting cancer younger and younger, colon cancer younger, breast cancer younger. all of those types of cancers can have genetic causes, and it can be life-saving for you and your family members.
Wow.
We could do a
So,
whole nother talk on this.
right. So we need to start asking questions and make sure we ask for this testing. That's the bottom line here.
Yeah. Yeah.
Okay.
And know your family history, right?
Mhm.
You might be visiting family for summer break coming up, talk to them about these things. It's hard to talk about cancer, but talk to them about these things, so that you can bring that back to your doctor and say, hey, I think I have a strong family history of this. Is there something we should do about that?
No, that's very good. How can listeners follow you or follow your research even and stay connected with you on social media?
I'm mostly on LinkedIn. I'm not on a lot of the other social media platforms. So you can find me on LinkedIn, Dallas Reed MD. Um, and also, please check out knowmoresooner.com to learn more about these, the myths around the genetic screening and actions you can take if you do end up having a high risk result.
Well, Dr. Reed, I want to thank you for coming on our show. It's been a pleasure to talk about these things that we didn't even know existed. So I'm glad you brought it to the forefront. And I hope that everyone who is listening to this now and the replay will share it with everyone. So thank you again.
Thank you so much. It was great talking to you.
Okay. And a big shout out to all of you guys who are watching the replay of the special edition, or sorry, this is not our special edition. This is our weekly edition. I shouldn't have said that because we just did a special edition earlier, but thank you for watching live and for watching the replay as well. Be sure to follow us on social media. Click on everything, follows, likes, ads. And until next time, I wish you all the best and much success. So take care. And thank you so much for listening, everyone.
Thanks for tuning in to Back Talk by Successful Black Parenting Magazine. We'll see you soon.